Why did I choose to become a CIMT? Early on in my career, I had met a manual therapist in the clinic and saw the great results that he was having with his patients, and I knew that that is where I wanted to go with my career. Why did I choose to become a CIMT? I ended up taking a Great Lakes course, and I was hooked from the organization of it, from the style of teaching, from the approachability of the teachers. I really felt like I left that first course with a lot of useful information that I could apply right away. And then as I started taking subsequent courses, I felt like there was a lot of overlap from the initial course and each course after that helped solidify my knowledge base. Two main things that I learned from going to the courses. The first is test, treat, and retest. What I learned from that is sometimes I would work with a patient and go through the my treatment, and they would say they felt really, really well, but then sometimes there was a return of their pain. I felt like with test, treat, retest, I would often just see the result of what I was doing, and it made the incidence of that patient coming back with some residual pain much less likely. The second thing is the JMFC model of joint, muscle, fascia, and compensation. I felt like it helped me look beyond like the typical problems that I would see with patients, especially was helpful with the more complex patient. I felt like the more I was treating people and the word was getting out, I would see more and more complex patients, but I was able to still get better results for those patients. Beginning, I often, as many of us as therapists have done, if I, for example, saw a shoulder patient, I'm automatically looking at the shoulder. And even when I started doing a lot of manual therapy with patients and assessing them a little bit differently, still looking at the shoulder joint. But I really feel like at that point, even if I got a patient, let's say 75 or 85% better, there was still some residual pain. As I've journeyed through all these classes, it's helped me look beyond the typical. Synthesis really solidified that for me. Patrick does a really great job bringing all of the courses together for you in synthesis and helping you understand how to kind of look outside the box, look not just at what you could look at to assess and treat, but why it's like that, which helps give you a deeper understanding. I felt like that as I've progressed through my career, I'm able to treat the more complex patients, and it's not something that is fearful because I have the tools in my toolbox to help them.